We've all experienced stress at one point or another. Maybe you waited until the last minute to study for an exam, or you had a rough time meeting some deadlines at work. But what happens to our bodies when we experience long-term stressors like unemployment or family struggles? This is a really long, complicated process to explain, but let me put it this way. It's pretty bad. Long-term stress can lead to disrupted sleep patterns, high blood pressure, various psychological disorders, and so much more. In order to actually understand the mechanisms through which stress wrecks your body, I suggest a few YouTube videos and studies that will be linked in the descriptions below. So we get it. Stress is bad for you. But what are the implications for society? Long-term stressors are also highly correlated with marginalized communities like people of color or LGBTQ plus folks. These communities tend to have lower socioeconomic statuses and have to face discrimination and stigma as they go about their daily lives. On a broader level, we can begin to see health disparities between oppressed groups and non-oppressed groups, like higher levels of heart disease, diabetes, and even shorter lifespans. The American Psychological Association did release a report on this topic that goes into a lot more detail, but it's 76 pages long. If you have the time, I highly encourage you to check it out, but for now, basically, higher stress means worse health, and marginalized communities tend to have higher stress. But within all the available research on health disparities, there is very little research done on one community in particular, people with disabilities. But before we talk about some of those stressors in particular, let's discuss the different frameworks of disability. Most of America sees disability through the medical model.
The medical model says that you want to try to cure someone like me sitting in a chair so that I'm capable of better mobility, so maybe one day I can walk, I get treatments that make my body function better. And it's really focused on the individual patient. I'm a patient in this situation, getting quote-unquote better. And then they fit into the world, and they perform in a way that allows them to be able to do things that they otherwise couldn't.
But there is another way to look at disability, and that's through the social model.
A social model of disability focuses on the idea that disability is not necessarily something that you possess from the inside, but something that individuals encounter based on societal barriers.
The social model, on the other hand, says that the world should be tailored for everyone. I shouldn't have to change my body or try to be cured in order to be able to get around equally. So the social model says that disability is not my body disabling myself, it is the environment disabling me, especially in certain contexts. Like when there's stairs up to the main entrance of a building, it's not that I'm disabled so I can't get into the building, it's the building does not allow me to get into the building. So that kind of framework shifts the idea of disability from the individual into more of an environmental setting.
If we look at the world through the social model, we see that the problem isn't the people with the disabilities, it's a world that isn't built to be accessible for them. Our current world is full of stairs, broken elevators, in-person attendance points, TVs with no captions, signs without braille, and so much more than that. We tend to think it's the disabled person's responsibility to find accommodations, but why exactly is it that way? Shouldn't everything just be accessible from the get-go? And these little stressors build up into much, much bigger stressors. Education access, for example, is a big issue.
Students with disabilities have a 66% college dropout rate. And for students with psychiatric disabilities, that rate is 86%. Since I dropped out of high school, it's been my life's work to really address those retention rates and really understand the problem. And the problem really is that we look at the person with the impairment and we say, it is on you to advocate for your access needs. And the reality is, there are so many ways in which that falls apart. You have to advocate to a professor that might be sexist, racist, ableist. And if you're a disabled student, with any number of intersectional contexts, you are not going to get what you need when it is based on self-advocacy, when everyone around you is learning from the deficit framework. It's just evidence of why people like you shouldn't be there.
With all of this stress, it's no wonder that people with disabilities are less likely to graduate high school, go to college, or end up with jobs. The classrooms and workplaces of today are not set up to be accessible for folks. Inaccessibility can also have a huge impact on one's psychological state. Just think about the kind of message it sends when something is inaccessible.
But honestly, when I can't get into a building, it just really says, I don't want you here. You shouldn't be here. Why are you here? Like, we've made it accessible. I've gotten that so many times from people. Oh, it's accessible, and then I get there and I can't get in, and I don't know how to get in or where to get in, and it's accessible, but where? And how? In what way? Like, do you really want me to be here if I'm fighting so hard just to get inside?
When things are inaccessible, it sends a very strong message that people like me don't deserve to exist. I dropped out of high school when I was 14. I was a straight A student up until that point, and then I became disabled. And all of a sudden, I was having meetings with my principal where my principal said, we have no space for you here. You need to go somewhere else. And it made very clear that I didn't have a place in society.
Things aren't accessible. It really just says that people don't care. They don't care. They don't care about me. They don't care about my problems. It just says that they really rather us, we don't exist. And that really plays into the medical model of things. We want you to be cured. We want your body to disappear the way that it is functioning at right now. We want you to be able-bodied or not at all. So it's just really frustrating when you live in a world that is not built for you because it says we don't want you here.
The built environment segregates people with disabilities from able-bodied people and therefore keeps many opportunities out of their reach. The long-term impact this type of stress has on health is quite stunning. A while back, the CDC released an article identifying health disparities facing people with disabilities as a public health challenge. As mentioned before, there are a whole lot of stressors this community has to face in terms of accessibility that other groups don't have to worry about, and the outcomes are drastic. People with disabilities are more likely to be unemployed, more likely to be victims of violent crimes, have cardiovascular disease, and importantly, a lot more likely to not be receiving needed medical care due to cost. And when people with disabilities do get healthcare, they're usually treated pretty differently than other patients would be. For people with visible physical disabilities, doctors are more likely to use baby talk, have stiff, awkward postures, and make assumptions about the patient's relationships, assuming that they must have a caretaker of some sort. All in all, getting healthcare is not the easiest nor the friendliest experience for people with disabilities, but this community needs quality healthcare, especially with the high levels of stress they may be under. So where do we start to tackle this issue? Accessibility means many different things to many different people. For some, that means elevators, curb cuts, and accessible entrances to buildings. For others, that might mean ASL interpreters or Braille text. Perhaps it means distance learning options and a more flexible work schedule. But we live in a world where all of that is not given right from the start. In order to begin eliminating this health disparity, we must first think critically about how to make our spaces more accessible. Whether it be your classes, your workplace, or even your social media accounts, start looking at ways to change things. A more accessible world means a much more accepting and less stressful one for people with disabilities. And shouldn't that be the world we're all striving for?